Good evening, and welcome to this edition of Community Conversation. My name is Ken Lalime. I'm the Chief Executive Officer of HealthyCT, the physician-sponsored, member-governed, not-for-profit health insurance company here in Wallingford. Tonight I am with Randi Oster, author of Questioning Protocol, which is a book that grew from her family's experience in the healthcare field with the healthcare system itself and some very interesting observations. We both know firsthand very much how complicated and confusing healthcare can be to the consumer, and we're here tonight to talk about ways that we can become more engaged and become your own healthcare hero. So let's get started. First, Randi, tell me a little bit about your background and how you came to this epiphany of trying to bring more information to communities.
I never, ever thought I would be a healthcare hero. And you know what? I really didn't even want to be a healthcare hero. But my husband has a pre-existing condition. My son has Crohn's disease. And my 87-year-old mother, she lives with me. And you know what happens? You get to know the hospital. And as you start to experience with different people the same system, you get a little bit smart. And you start to see that there are protocols, there are processes, and there is a need to advocate for yourself and your loved one. And so in my case, I was fortunate with my background in aerospace engineering and corporate America. I was able to take that background and combine it with the compassion I have for my loved ones. And I said, everything I did to help them have high-performing teams can help others. And I wrote, as you said, I wrote the book. And the book is all about how do we empower each other. And that's why I'm so excited tonight to be with you, because I want to share the tips, the tools, and the tricks so that other people can feel empowered. So, you know, that's what happened to me. But you're the CEO of a insurance company. And so what took you down this path? Because it's a special company.
I call it a very interesting pathway. I'm a pharmacist by training, education, own my own drugstore for 10 years out in the real world. But I've basically worked on the provider side of the healthcare system for 30 plus years. I worked in a hospital for 17 years in many different capacities, worked with physician organizations and helped build physician practices. And then an opportunity came along as part of the Affordable Care Act to help sponsor and finance, basically with loans, organizations throughout the country that wanted to bring additional competition in the insurance industry to their marketplace. Very unique organizations. They are all not-for-profit. They're called co-ops. It's called a consumer-operated and oriented plan. Kind of a long way, but it's a co-op. And a co-op is basically a group of people all getting together with a similar thought process and mission. And so it's not-for-profit. So any profits that we make actually get rolled back into premium stabilization and better programs, quality kind of initiatives.
Good.
So this idea came to us, and we got together. I was working for a very large physician organization in the state at the time, and we got two very good sponsors, the Connecticut State Medical Society and the Connecticut State Medical Society Independent Practice Association, which was basically a network of 7,000 physicians throughout the state. And those two organizations sponsored the application to see if we could get a sizable loan to get a brand new insurance company started to compete with the other insurance companies in the state of Connecticut, as well as to be part of the insurance exchange, so we got access issues and all the rest with members. So it was a very unique opportunity. I've felt very passionate about getting people the right level of health care, and now the next level is, how do we use it?
How do we use it?
How do we use it effectively so we don't end up with, gee, now that I have health care, what do I do?
Right.
You know, kind of thing. So I think what brought me here was a working on the provider side. I felt a lack of coordination, a
Really?
lack of
I've never experienced that.
with insurance companies. They were, it was status quo was working just fine. I think the Affordable Care Act has generated a lot of things, some good, some not so good, but I think it's generated an enormous amount of conversation that we're going to continue tonight, and try to flush out some of the things that people can do. I mean, people, I think, right now feel very not empowered. They feel like, I have this thing, it's expensive. What do I do with it, and why is it? I mean, insurance generally, some of the reasons I got involved in this is that so many people were using emergency rooms
Right.
as their way of receiving health care.
That's right.
Expensive, not efficient, just it's not set up to be that, but many people do that. So there's ways of trying to move that interaction that is happening between patients and providers into a better setting
Right.
where it doesn't cost as much, quality is improved, and people get a better experience in doing that.
But people don't know what to do. And, when you talk about even the emergency room, I know all the emergency rooms here in Connecticut, and unfortunately, we didn't have a choice. But when you're sick, right, and you don't know what to do.
What is your greatest challenge? You opened the door to a great area. So what's
Right.
your biggest challenge with all that? Or did you find as you were walking through that process?
So, when my son's screaming in pain, and you ask him on a scale of 1 to 10, what's your pain level, and he says 12, you show up at the emergency room.
Yep.
Okay? You end up, in my son's case with Crohn's disease, admitted to the hospital. And you know what the greatest challenge is? We don't know how a hospital works. We have a loved one in pain. We don't know what's wrong with them. And the next thing you know is there's, I'll call it a machine, a high-performing machine that is processing lots of people. And you're there as they're going through. But you're not, in my case, my son was up for 2 days screaming. We hadn't slept. We were scared. We were lost. We were confused. And how in the world are we supposed to figure out who all these people are? They're coming in the room. I couldn't tell the difference between a nurse and the doctor and the person who was cleaning. It was so much. And then what questions do you ask? And then do they have time to ask? And even, how much does this cost? Am I covered for this? Where's the doctor? Is he going to be okay? And all of a sudden,
That's a lot of things to process all at once. And that's all happening so fast.
It's so fast, Ken. And so, and the truth of the matter is, I was like everyone else. I had an insurance card. Don't ask me if I ever read anything that was in the policy, okay? I had no idea, and I didn't even know what our options were. And then I was intimidated to ask because I felt that when I was asking questions, I was slowing down the machine. And so the greatest challenge is really to have the confidence and the understanding. We have to get a little bit of control, and we have to have some responsibility, and we have to find the people that can help us do that. And that's what I didn't know. You know what I wanted? I just wanted a hug. And it was my son that was sick, and I was there every single second. The system wasn't designed for hugs. The system's designed for processing, and not that it's bad.
It's good at that, right?
It's very good at that, and I'm not saying it's bad, but that expectation of our roles and how we can get high-performing teams and get care that's meant for our preferences, our goals, and our values, who we are, can happen, but it's our job.
Absolutely. So that brings in the next question. I think you threw a lot of things into the middle
Sure.
of all that. One that comes to mind quickly is, that the challenge that everybody has related to health insurance benefits. We have those things. So it's, a challenge, and I guess there's I get questioned quite a bit on, what, is that a challenge for an insurance company? We are insuring people, but what else can we do to help people make that transition to having insurance and then using insurance properly? There are essential health benefits that are actually part now, because of the Affordable Care Act, there are parts of every single person who has health insurance. Now that 9 out of 10 people in the country have it, that's great.
Right.
But that they don't know that there are pieces of everybody's benefit plan that they can use with absolutely no cost.
No cost.
And
this is new.
It is new.
It's
It is
new.
very new, and people don't take advantage of getting preventive care services. And there's a host. That's not just an annual physical.
Right.
There are components that are available. Call your insurance company and find what are my essential health benefits that I can get.
Yes.
And those things can certainly get you moving into the healthcare system at no cost.
This is so important. When I speak to so many people, right now their deductibles are high, right? And their coinsurance is high, and their copayments is high, and there is a sense, I'm not going.
Well, you just used 4 terms that I will bet most people watching the program tonight don't know.
They don't know.
So I'm gonna put that into a concept called health literacy.
That's right.
Now, health literacy is a very broad term, and I'm a huge advocate for education, huge advocate for getting people to better understand lots of different pieces. So the piece that we were just talking about is health insurance literacy. Just to know, the difference between a copay,
Right.
which would be I pay a fixed amount of money when I walk in the door for that service, and the insurance company pays for the rest,
Right.
versus a co-insurance, which would be you pay a percentage of what the price is, and the insurance company pays the rest. Now, where that happens the fastest, where we see it every day, so practical implication is when you go to the pharmacy. If you have a benefit plan that you have to pay a copay, you pay your $10 or $20, no matter what the prescription costs. If you pay a coinsurance and that prescription is $200, you might be paying $100 of that instead of, and you don't know what it is each time you walk in the door.
And people need to ask these questions. So, for example, my son has Crohn's disease.
I'm sure you're in the pharmacy a lot more than you want it
Well,
to be.
one of the things when you talked about how we built that high-performing team, my son found a doctor that helped him find a nutritional approach. But there are many people that I know with, for example, Crohn's disease that take specialty drugs. And when they're first recommended to take some of these drugs, they have to ask, how much does it cost? And that means, do I have coinsurance or is it a copay? Now, what's so scary is you don't want to make a medical decision based on the price of the drugs. But it's better, I believe, to at least go in knowing that, and then even asking, what are my options? Because, for example, with my son, the nutritional approach worked. It doesn't work for everyone, okay? It doesn't work for everyone. But thank goodness we tried that first.
It's an option, absolutely.
Yeah.
So, and so you touched on another piece here, that is, you found an advocate, I'll call it, and whether that be someone that is helpful in the care management department of an insurance company.
Right.
I have a small little story here
Okay.
related to that.
Okay, good.
Or you found somebody in a community environment, whether that's at a physician's office or a
Right.
community. There's a lot of community resources that people don't always take advantage of.
Yes.
So my story is that
Yes.
I'm a pharmacist by education, owned my own drugstore, worked at a hospital for a long time. And so I went from working on the provider side to now running an insurance company. I went from a very trusted person in my community. I think in one day I became this insurance executive, and all of a sudden, insurance companies tend not to be as trusted as we would like them to be. We have a lot of resources, but the general public, it's usually a financial transaction.
Right.
And so the difficulty there is recognizing that may exist, but how do we then, where is that trusted relationship that consumers need so that they can ask these questions, so they feel more comfortable having someone help them. And so what we have found, and to do that, we've also got to change how we pay for that and how we look at different components. Instead of only concentrating on cost, we need to bring quality into that equation.
Right.
Because that equation, you were talking about the value of nutritional counseling
Right.
and medication potentially,
Right.
and a relationship. Those things all lend to that calculation of what is the value to me, which will be different than someone else based on what information I have. And so it's getting access to that information, thinking about quality a little bit, and that access to that information can come through your insurance company. We're finding more and more that the advocate, the consumer really needs to engage with is a primary care physician and or their practice. Primary care practices are changing. They're really making a difference in this community that we all live in. That place, we can call it a medical home, a place where people feel comfortable asking questions, because that's so important. What you said is, asking the questions and getting some answers. But what we have to do as an industry is enable that process to happen so that people can take a little bit more time to answer those questions. So we have to find ways of paying for that differently than we pay for it today.
I applaud you if you do that. Let me explain that conversation that we had with my son's doctor the day he had to choose an approach to live with Crohn's disease. The appointment was scheduled for 15 minutes. 15 minutes. And he came into the room and he said, well, it looks like the Crohn's has progressed. We're going to have to look at other medications. And then he hands me, and I remember it was green sheets of paper, just like this, 5 of them. And the name of the medication was on top, and embolded in the middle was an increased chance of lymphoma. Do you think I heard anything he said? He went on with that medication and he talked about 3 other options, and I was in shock. And what I needed is exactly what you're talking about. Someone who was able to talk with me and to figure it out. Now, in my case, aerospace engineering, quality, I know how to look at and evaluate options, but not everyone walks in, building, jet planes, okay? And that's not fair to have that level of expectation. And so what was also fascinating to me as my son progressed and he had complications from a surgery, it was 3 weeks after the surgery, and I thought he had stomach pains, so I called his pediatrician. The pediatrician thought it was the stomach flu. And what I didn't understand at that point was the connection between the operation and the pediatrician. I was supposed to be connecting all of that instead of someone saying, you know what, I'm watching her son go through a journey. Mm-hmm. They were looking at station stops.
Process.
Boom, boom. To the point of, because that's how they're paid, Ken. And people are not bad. The system, this is to your point, the system is designed to do station stops, okay? And what I love hearing, and I hope you're successful, is we need to look at the person and their health. And what I was able to do, and what I'm hoping to help others do, is develop those skills, to know the questions, to find those people. But if it's part of your program, that's the ultimate in power.
It is, and because physicians have been paid for, since really this has gone on forever, since Medicare came in the mid-'60s. So for 50 years, it has really been based on you come to see the doctor, usually because you're sick, not necessarily because you're well and want to stay that way. Usually because you're sick. So you go to the doctor, they see you, they get paid for that event. The system has become very good at having that happen. Go to the doctor, pay your copay, have your visit, doctor gets paid. What needs to turn around a little bit with that, and some of the things we're bringing forward, is how do you compensate a physician or their practice for doing emails, secure emails,
Right.
for doing not what we'll call non-face-to-face encounters. You pick up the phone and you talk with your physician. Where does the payment for that come from? It can't. It's not 2 minutes on the phone cost X, Y, and Z.
Right.
So what we're trying to do is to say, okay, we'll provide some funding for you on a monthly basis to provide a different set of services, a coordination of services, so that they would be able to answer, gee, if my son or if I need an MRI, where's the best place to go for that?
Right.
So we have to bring things into the fold for, things that haven't always been there. Some aspect of transparency on pricing. A big
Oh,
issue.
that'd be-
I'll let you
oh.
have that one in a second. So that's
Oh,
one piece of it.
yes.
Somebody's benefit structure. How can they best utilize this, and balancing that value calculation of quality and cost and individual. So how do you individualize care instead of robotically walking through that process? So we are trying to work with primary care physicians around the state that are looking to engage in a different type of process. Now, this is happening in all parts of healthcare. There are organizations being built called affordable, under the Affordable Care Act, accountable care organizations,
right.
ACOs. And it really is trying to get at that, looking at population health and trying to say, how is the health of the population that I am managing, how are they doing?
Right.
And how do we get at that type of stuff? And then how do we fund that differently so that those types of things that we talked about don't become just a 15-minute the experience and the need for a longitudinal way of looking at healthcare. And then we can finally get at, I don't go to the doctor only because I'm sick. I go to the doctor or their associate or whatever to stay well.
To stay well.
That's where insurance companies can help. Maybe they're not the most trusted, but they have access to things on websites that you can get into wellness programs. And every insurer has one out there. They are so underutilized, it's amazing.
I don't think people
Probably only
know.
3% of the population that has access to it uses it.
Yeah, I don't think we know about it.
And many people don't know about those things. So
They don't know about
we
it.
all are battling that same, how do we get to it? Having that advocate for you, finding that right person. You went through this process and found some wonderful advocates by the
Wonderful.
time you were done, and now creating a few.
And now creating a few.
So I think that primary care physician relationship that we're trying to build is really paramount to the success of the system.
We have to do what's right care, not too much, not too little. And the system, as you've described in the past, they were paying for more.
More
And
is better.
Not necessarily.
No, it isn't. Sometimes more is more money.
Right, more is more money. So, and I'm going to give a quick example. My son, every time he was in an emergency room, CT scan. And finally, when we went after like the fourth one, and I learned the CT scans don't show anything, a doctor said to me, Randy, one CT scan is like 1,000 X-rays.
If that's the situation, people might start glowing pretty soon.
I didn't know that. Oh, my goodness. But that's how they were paid. And the power that I learned was the power of the word no. Ask why, say no. And you know what I discovered when you ask why and say no? They come up with plan B. There's an alternative. And if you're building in, what I'm hearing is a process where they can be compensated and do not disease management, because that's what you were describing, a disease management system, but a health system, that would be fabulous.
And it incorporates some of those things that we used to call disease management. How do you manage my diabetes?
Right.
So diabetes becomes part of the conversation of what are we doing? Do you have a nutritionist?
That's right.
Primary care practices are changing, and it's going to take a little bit of time, but it is really that engaged consumer. I mean, we're trying to think of, okay, how do we, on the ground level, start this change? Because it's not something that's going to happen tomorrow. Part of our conversation tonight is how did you and where are you headed with that advocacy? And if we know we've got to engage a little better, if we know we need to change some of the funding, and that's some of the insurance industry responsibility, but the engagement with a consumer and a primary care provider or someone, and it can be a community resource, it doesn't have to be a primary care physician, that's my favorite. The mechanism of doing that, engaging there, can really help with benefits and some others. So you have some additional ideas on how to make all that work, and I'd like.
So the important thing is we didn't go to medical school. They don't teach this in high school, and the way you learn is asking questions. And
Eventually we'll teach it.
I hope so. I hope so. But in the meantime, right, tomorrow, anyone that needs help, there are, as you mentioned, a lot of resources available. And I have a website, and they'll see it down below as we're talking. But I want everyone to know there are 5 questions that they can ask, and it will be on the website. But it's okay to ask, do I really need this
And does
test?
this come through a certain
So
program?
this is through Choosing Wisely.
Choosing Wisely,
So
very, very good program.
So Choosing Wisely, oh my goodness, you're intimidated, right? There you are, you're intimidated. What should I ask? Is it okay for me to ask? You can go online, you can print off the questions, and you could go, wait. I need to know, what are the risks? Are there simpler, safer options? What happens if I don't do anything? And then how much does it cost? And you know what? It's okay to ask these questions. And to me, questioning protocol is the key to building that high-performing team. And then when you find someone who listens to you, and may it be that primary care physician, hold on. Hold on. That's a wonderful relationship. And I'm grateful my son is, knock wood, doing fabulous. He's on the nutritional approach. And
That's wonderful.
And it's because we empowered ourselves, and having that, and then an insurance company that is looking at how do we really redesign this, I think can be the future that we need it to be for our country.
Well, I think there's an awful lot of really wonderful conversations like this that are going on in our communities
Yes.
all over the country. I think Connecticut has some wonderful things that are going on. We have some tough things to handle in the state, but I think on the healthcare platform, there are a number of initiatives that will really help consumers help themselves, and they need to get engaged with the system to better utilize the benefits that they get. It's not just looking at the cost of insurance. It's how do I use that so that my insurance works with me and for me.
Right.
So,
Wonderful. Okay.
well, thank you very much for your time tonight.
I love it. Thank you.